Hi everyone, so this is just going to be a quick teaching plan for high fall risk patients. The first thing that you're going to do is you're going to assess your learner's knowledge and understanding. So this is going to include assessing the patient's and the family member's prior knowledge and understanding. For the high fall risk patient, the first step would be to assess the patient's total risk factors, which could either be individual risk factors or environmental risk factors. Usually what we see is a combination of both. Individual risk factors include age-related changes, cognitive deficits, gait strength or balance deficits, sensory deficits, chronic conditions, acute illnesses and behaviors or choices. Environmental risk factors include medications, footwear, assistive devices, home and neighborhood features and accessibility, alcohol and drugs, and support from caregivers. Once this assessment has been complete, the patient should be consulted regarding what they perceive to be limiting their ability to safely ambulate. The patient should be asked if they are afraid of falling or if they have previously fallen. The patient should also be assessed for their orientation to self, place, and time to ensure the teaching will be effective. If the family plans to be present, this education and assessment process should also be applied to involve family members. Patient use of assistive devices should also be assessed to ensure proper use. Consult with physical therapy to initially assess patient's gait, proper size of assistive devices if indicated, and provide suggestions for nursing staff to assist the patient. Patient understanding of preventive measures should also be used. Some questions you can ask yourself or your patient is, does the patient understand the use of the call light? Is the patient using non-skid footwear when ambulating? Is the patient wearing a high fall risk band or yellow gown indicating that they are at fall risk? Does the patient understand the use and necessity of the bed and chair alarm? Does the patient understand medical equipment is a possible problem that might require assistance? Does the patient understand the importance of keeping a clear path when ambulating? Does the patient understand the current health problems and how that may affect their ability to safely ambulate? Does the patient routinely implement mild to moderate physical activities to improve physical strength and coordination? And does the patient understand their medications and side effects?
The initial teaching environment should be quiet, where the patient feels safe and secure and can ask questions. If family is present at the bedside, include them in the teaching to promote safety and prevent falls. Educate the patient on the importance of utilizing their call light when wanting to get out of bed or need assistance to the bathroom. Once physical therapy has done an initial evaluation on the patient's gait and has provided guidelines for assistive devices or recommendations, re-education is key. Ensure that the television is off and limit distractions while educating the patient. Ensure that the patient is comfortable. You may sit next to the patient or maintain eye contact, which can promote rapport with the patient and promote autonomy. Educate the patient that frustrations may be common when having to call staff for assistance to ambulate, or the annoyance of potential use of chair or bed alarms. Ensure that the patient safety is their priority during the hospitalization, and encourage them to be patient and talk to the staff when they are feeling frustrated. The use of fall bundles such as yellow gowns, non-skid footwear, fall risk bands, or alarms may be indicated for the patient. While educating the patient, ensure that they have generalized understanding of why fall precautions have been placed. Learning objectives and goals for fall prevention education can include risk factors for anticipated, unanticipated, and accidental falls. This may include intrinsic or extrinsic risk factors. Patient compliance to utilize staff, call light, and other assistive devices is important. Re-educate the patient of the importance of fall precautions and their safety. Many hospitals have fall bundle protocol that's in place, which can include yellow wristbands that say fall risk, non-skid footwear, and a yellow gown indicating they're a high fall risk. Other colors, such as blue or green, can indicate lower fall risk. Bed or chair alarms may also be utilized. Ensure that the patient has their call light within reach at all times, and make sure that the pathway around the bed to the bathroom is free from clutter. Always ensure that there is a well-lit room when the patient is ambulatory. Fall risk screening assessments are common during admission and throughout daily use with the patient. Physical therapy consults to assess patients' gait and their need to assistive devices or recommendations. They also size if the patient needs crutches, walkers, or canes. Always encourage medication review with the medical professional team and whatever potential side effects that can increase patients' fall risks. Assess level of consciousness, willingness to call for help, and any language or cultural barriers. This is an example of the Morse Fall Scale, which has a history of falling, secondary diagnosis, ambulatory aids, if the patient has any IV access, how their gait is, and mental status. And this is just an example of a fall risk scale that some hospitals use. Some learning objectives for this presentation is that the patient will remain free from falls during their entire hospital stay. The patient will be able to identify 3 ways to prevent falls in their home before they discharge. This can be as simple as having a nightlight in the hallway at night or making sure that rugs and pets are out of the way when walking. Another objective is the patient will use their call light every time they need to get up and use the bathroom during their hospital stay. This may be frustrating for the patient to get used to if they were independent at home before hospitalization. The last objective is the patient will identify 2 reasons why it is important for them to use the call light every time that they need something or to ambulate by the end of the shift. Teaching strategies and rationale. Teaching always begins at the time of admission and continues throughout hospital stay. It's important to educate the patient from the initial time of assessment and re-educate throughout the hospital stay because it reinforces the importance of patient safety. Often patients are independent before admission to the hospital, and remembering to use their call light or wait for staff may be a challenge. During the initial assessment, evaluate the patient's prior knowledge of fall precautions. This prevents the patient from feeling they are being talked down to by staff. Consider the patient's level of consciousness upon arrival. If the patient has altered mental status due to injury, medication, or intoxication, the patient may have poor short-term memory or other barriers to learning. If the patient speaks English as their secondary language, ensure there are proper resources that are available, such as a translator or handouts in their primary language to promote proper communication and teaching. After educating the patient on the proper use of the call light, any rationale for fall bundle precautions, encourage the patient to repeat or demonstrate back what was taught. This promotes the reinforced education and allows the patient to ask questions. Erikson's model of psychosocial development is very significant and a highly regarded, meaningful concept. Life is a series of lessons and challenges which promote growth. The theory is helpful for continued child and adult development. Patients at every developmental stage with health issues are considered a fall risk. During assessment, the treatment team must assess the patient according to their developmental stage and initiate a plan to prevent falls. The team also utilizes Maslow's hierarchy of needs to promote patient safety. Safety is the second highest priority according to Maslow after physiological needs. The treatment team should utilize different methods of learning to provide the best education possible for the patient. The initial teaching environment should remain distraction-free to ensure the best education. Nurses should incorporate both Maslow's and Erikson's theories to promote adequate learning. Continued education and reinforcement of fall precautions during hospitalization is vital to ensure patient safety. Gentle reminders around the room, such as signs that say "call, don't fall," may be placed in the patient's hospital room. Here are just some of our references from our outline and video presentation.